because there's a lot, like President Trump talked about this. He signed this executive order to make price transparency for healthcare, right? And for hospital bills and medical billing. Yeah. And we talked about it last time you were on. You said your wife was giving birth and you didn't even know like how much it was costing. Like, what does this cost? And what if we get the amnesia? Or your wife's like, I don't want any amnesia or whatever. And you're like, you should take it. And you're like, how much is it? You know? But it's like, nobody knows, you know? And then they're putting $30,000 of amnesia in your wife. And you're like, well, shit. And so it's like, but what I'm saying is everybody at this point is but it's a $100 trillion, multi-$100 trillion industry that's going to change. Will we actually see it take place? Like Biden administration tried to get price transparency. They were too caught up. They couldn't get it done. Trump signed the executive order. Do you think we will actually see this happen?
So I do. I think it's going to take a little time, but we took the first big step when the president signed that executive order. And you asked this question about donors, right? So the pharmaceutical industry gives a ton of money to Republicans and Democrats. And I'll tell you, they were not happy when the president did that. And the president's attitude is, look, it's the right thing for the American people. So I think, again, it's an example of when you've got to tune out the financial pressures of politics and just do what's right.
Well, people are afraid to get sick, not because
dude, let me
sorry, am I being loud to you? I'm sorry, Jimmy.
No, you're fine. Okay. Here's something. No, I mean, your normal volume, I would say.
Okay, sorry. I felt a little ambient. It's not towards you. I'm thankful that you're spending time with me.
No, you're good, man. Okay. So I'll tell you a crazy story. A buddy of mine was visiting recently, he's a friend from back home. And his wife told me this story that his kid, they thought he was special needs, maybe he had sort of a neurological disorder because he was sort of emotional or not emotionally, educationally behind his peers. Turns out he was just deaf. He needed a cochlear implant. And it took this, my buddy's wife just fighting with the insurance companies for forever to get this kid the medicine that he needed, the treatment that he needed. And now the kid, he's happy, he's healthy. It's a beautiful child, smart child. Like, that's amazing, right? That's what we want medical science to do, is to take a serious problem and make it better. Well, why do we have a medical system in this country where too many people can't get the treatment that they need? And it's a complicated answer to that question. But one of the big problems is, and I don't think most Americans realize this, we subsidize. When you go to the hospital or you go to the doctor and you pay out the rear end for a treatment, you are subsidizing all of the therapies all over the world.
Tell us what subsidizing means. Some people won't know.
So basically, we pay more so that Europeans and other parts of the world pay less. So we fund all the innovation, we fund all the development of new drugs, and then Americans pay way more. That's why, Americans, we spend 22% of our economy on healthcare. The Europeans average out about 10 or 11%. So we spend way more on healthcare and they spend way less. So the president uses this example all the time. The Ozempic, as he calls it, the fat shot drug. He had a buddy who was on Ozempic and had to go to Canada to get it, even though it was invented in Europe.
Yeah.
And it was mass produced all over the world. It was like a tenth of the price in Canada that it was in the United States. Yeah. And the way that it is the drug companies make money off Americans so they can offer discount drugs to everybody else. So what that executive order, the reason why I think that approach is going to work way better than anything the Biden administration is doing is it's going to say the Americans get to pay less and the Europeans are going to have to pay up a little bit. You'll know more about what you're spending on, but it also is more fair to Americans. And I think that's a win-win scenario, because you can't expect Americans to pay 10 times for prescription drugs what other people pay. It's also, by the way, not that this is the main issue, but it's bankrupting people and it's bankrupting our country. Because we spend so much more on healthcare, and that's a major driver of our budgetary problem.
It's the number one cause of bankruptcy is medical debt.
Yes,
and
it's
like people aren't afraid to get sick because they'll be sick. They're afraid to get sick because they can't afford to be sick.
That's right.
And the stress of it is going to kill them.
That's right.
But do you think, like, he made the executive order, do you think and I know it's like so hard to be like, do you know, but it's like, do you really think we'll see this? I mean, it's like, God, give the people something.
I do. I do. And we got a great Secretary of Health and Human Services, Bobby Kennedy. Has Bobby been on the show before?
Yeah.
Okay. He's a good dude. He's a good friend of mine.
We had Bobby when everybody thought he was insane, dude. Hell yeah, dude. He had to give him a ride home. His vehicle had been repossessed, dude. Yeah.
Oh man,
I'm joking.
Yeah, so Bobby's
congratulations,
a good,
Bobby.
Yeah, we should have known that for the Senate confirmation hearings. But yeah, man, Bobby's a good dude, and he really cares about this stuff. And this is what you need. You need the will, you need the good idea, but you also need the implementation. I think the president's got the good idea. He's got the executive order. Bobby's got the implementation. So like, look, am I going to tell you sitting here that all of our healthcare problems are going to be fixed in 12 months? No.
Right.
But do I think that this is going to make prescription drugs way more affordable over the long term? Absolutely.
Okay. Yeah. And I know a lot of people might be critical of this interview and stuff. It's like, I'm doing my best, right? I'm trying my best, and maybe I'm just too hard on myself sometimes.
Why would critical interview? Because I'm a politician and like,
Yeah,
it's
well,
partisan.
I think people expect. I don't
But
know.
you would have a Democrat on.
Huh?
You would have a Democrat
We
on.
got
Didn't
Tim
you have
Walz
Bernie?
coming on.
Oh, nice. Okay. That'll be interesting.
But no, I never met him. You know what I'm saying? We got him coming on. So it's like, yeah, I'm definitely trying to learn more about it.
Honestly,
but it's like,
he's a nice guy. But I think
yeah,
that's what,
I'm not a, I don't know the history of everything, right? So it's like, I feel like we're just
Nobody
trying to do
does.
our best, and I'm trying to do my best with somebody who I consider a friend, and and to learn in as we go. Anyway,